A very good morning and a warm welcome to our esteemed doctors, our beloved colleagues, and my lovely audience for joining us here today for this session. It's my pleasure and an honor to welcome you to this panel discussion as we celebrate one of nature's gift to mankind, breastfeeding. I'm Dr. Kavya, your host for this session. In 1990, over 30 countries and global establishments came together in a city called Innocenti, France, to set protocols for breastfeeding and make it a normal process for families to follow. In 1991, India adopted these practices, and these practices till today, which is 32 years post 1991, we still have to progress a lot, but yes, we still have a long way to go. Without further ado, let me call upon Dr. Padmalatha, our moderator for today, who's Senior Consultant, Obstetrician and Gynaecology. Dr. Padmalatha has graduated from Bangalore Medical College and has done her DNB OBG from Bangalore Baptist Hospital. She's also trained in gynec endoscopy, robotic surgery, cosmetic gynecology, and obstetric ultrasound. She has over 20 years of rich experience in her area of specialization. Before joining SPARSH Group of Hospitals in 2014, she was associated as a DNB teacher and a consultant at St. Martha's Hospital and Bangalore Baptist Hospital. Dr. Padmalatha believes in a patient-centric approach and follows it religiously. She believes in age-old adage, believes in knowing that the best for the mother is to encourage the new mothers to follow skin-to-skin golden hour, delayed clamping, and encourages all the mothers to do exclusive breastfeeding. Over to you, ma'am.
Dr. Kavya, for the warm welcome. And I welcome you all for this gathering wherein we are going to have a small panel discussion to clear the usual common doubts and help in enhancing and encouraging breastfeeding for a healthy baby and a healthy nation. So, as we all know, and again I'm going to emphasize a few points about the benefits of breastfeeding. Breastfeeding is very beneficial to the baby and the mother. To list a few, it is baby-specific nutrition. This breast milk, whatever, is extremely customized to the baby's needs, and hence it cannot be replaced by a generic formula. So a formula is for everyone. We all wear clothes according to our own body sizes, figure, and our taste. So, but formula can never be, you can never have one size for all. Similarly, a breast milk from the mother is customized for the baby, and it provides hydration. For at least 6 months, the baby can survive, thrive, and grow well and be healthy on exclusive breastfeeding. So, baby doesn't require even one drop of water in addition to breastfeeding. So, this proves that it is extremely good for hydration of the baby, and it is comforting to the baby. Since it is customized and it's good on the baby's gut, the baby is happy. It contains live immunity. There are a lot of antibodies or the proteins which are fighting against infections which are produced in the breast milk, and these directly help in preventing and controlling any germs which enter the baby's system and fight them and help to build their immunity. It also helps in reduction of what we call as SIDS or sudden infant death syndrome or cot deaths. These are very unfortunate. Healthy babies sometimes go away because of say formula. They are overfed and without burping they are made to lie down, and then unfortunately the babies choke on their own secretions, and this is very less when it is breastfed, because breastfeeding just is appropriate to the baby. It can never be more. So whatever is required is provided through the breast milk, and it helps in reducing disease risk by prevention, since the pathway from the milk to the baby is nothing, it's a direct installation into the baby's system. So there is no any formula preparation methods, the apparatus sterilization, these problems are not there. So there is no extra introduction of germs, and whatever are the germs which are going into the baby are always controlled with the antibodies provided by the breast milk, which helps in preventing diseases. And healthy weight gain, yes, it is healthy. It's appropriate, neither more nor less. More is not always healthy. That is what we should understand. And there are, of course, lots of benefits for the mother as well. It helps to lose weight because one healthy breastfeeding mother almost spends 400 to 700 calories, and this itself will help her in maintaining her weight. And it helps the uterus to contract in the initial post-delivery period, which helps in bringing the uterus back to its previous size and form as soon as possible. It lowers the risk of depression. Breast milk secretion is by a hormone called oxytocin. This is a happy hormone. This happy hormone definitely helps the mother and the baby for reducing the chances of depression. You mothers would have seen that babies feed and look at the mother, smile and go back to feed. This is because they are enjoying it, and the oxytocin is one of the important reasons for that. So that way breastfeeding helps the mother as well as baby. It prevents early osteoporosis because of the turnover of breast milk. Calcium deposition happens in these young women, and which goes a long way in preventing weakness or porosis of the bones. Amenorrhea, a mother who is regularly breastfeeding with including at least 2 to 3 feeds at night experiences good amount of time where she does not have periods. This is very natural, and this helps in preserving her blood and reducing anemia and also contraception, because the ovulation is prevented by this method and hence there is contraception. Of course, it is financially benefiting. You are not paying for the formula, you are not paying for the sterilization methods, you are not paying for the all the apparatus, and because the baby has less diseases, definitely you are saving a lot on finances as well. Hence, there are lots more benefits of breastfeeding which I can't cover in this particular time. We will go ahead now with the panel discussion. So clear further more doubts and the practical aspects of breastfeeding. I would like to invite our panelists, Dr. Mohan D. Mahendrakar is a senior consultant neonatologist and pediatrician. Welcome, sir. Dr. Mohan completed his MBBS from BLD Medical College, Bijapur. He also earned his diploma in child health from Bangalore Medical College and DNB from Kanchi Kamakoti Child's Trust Hospital, Chennai, and also has a fellowship in perinatal medicine from Rajiv Gandhi University of Health Sciences. With over 16 years of experience and being previously associated with major hospitals in the state, and Dr. Mohan believes that there is no substitute for mother's milk. Welcome you, sir.
Thank you.
Dr. Anil M.U., Senior Consultant Pediatrician and Intensivist. Dr. Anil M.U. is a Consultant Pediatric Intensivist and specializes in pediatric allergy, asthma care, pediatric critical care and general pediatrics. With vast experience spanning decades, Dr. Anil believes in identifying and addressing the nutritional growth, developmental and behavioral problems of a child to provide a holistic care. Welcome you, sir.
Thank you.
Dr. Divya is a consultant obstetrician and gynecologist. She had her finished her MBBS from MS Ramaiah Medical College and went on to pursue DGO from Kasturba Medical College. Over the last decade, she has worked across hospitals for an enriching experience in managing high-risk pregnancies. She believes medicine is ever evolving and in constant learning of the latest techniques in the field. Welcome you, Dr. Divya. Let's not forget the most important, Dr. Swathi Ji Thippeswamy. She is a physiotherapist specializing in obstetrics and gynecology, a lactation consultant. Apart from physiotherapy, she also provides childbirth education and breastfeeding support to mothers and their families. She is committed to the well-being of the mother and baby and strives to give each mother a joyful breastfeeding journey. She strongly believes that an empowered mother is a force of nature and nothing in the world can replace the bond a mother and her baby share. Now, over to our panelists. So, I would start with Dr. Divya. How can the obstetrician prepare the mother-to-be during the antenatal period for the upcoming breastfeeding journey? Dr. Divya?
Yeah, good morning one and all. As Dr. Padmalatha has already introduced with the saying about the benefits of the breast milk both for the mother and the child. So during the antenatal period only we'll start tuning the mother as well as the father, like the couple. Together we sit and talk to them about the benefits of breastfeeding, exclusive breastfeeding to the child as well as to the mother, and also about the care of the breast. Usually we say to there is a lot of breast changes which happens during the course of pregnancy for the breast to prepare itself to produce the milk. So we explain about the changes that happens in the breast, and there may be little tenderness because of the changes which happens in the breast during pregnancy. Also the nipples become enlarged, the areola increases, and that Montgomery tubercles, what we say, around the areola, those tubercles start secreting few liquids to moisten the nipple and the areola. All these changes helps to prepare the breast and the nipple for the breastfeeding once the delivery happens. So we try to explain all this to the mother and the concerns what the mother has during the pregnancy. If the mother has any inverted nipple or small nipple, those things and all, we try to educate them that those things can be corrected, and with the proper training post delivery we can breastfeed the child even with these problems. So I think this is what we do in the antenatal period.
Thank you, Dr. Divya. So to summarize, there is discussion with both the partners. Mind you, the partner and the family, extended family, are very much involved in helping for the successful breastfeeding to ensure. Antenatal breast and nipple preparation, breast care. Women with special health concerns sometimes need to be addressed. People with cardiac diseases, anemia, these can be corrected, and this helps a lot in making them confident that they can pursue breastfeeding. And also encourage a discussion with lactation team. Participation of lactation team much before delivery itself keeps them well prepared, and then they can go ahead with the successful lactation later on. Dr. Swathi, should I buy a breast pump and be ready to pump when I deliver? This is a common doubt which to-be mothers and parents have. So what can we advise them?
Well, the outright answer is no. Do not buy a pump. Simply because we do not know if you require a pump. We do not know if your baby requires pumped milk. When you can directly breastfeed, why do you want to go through the hassle of pumping, sterilizing the pumping equipment? And of course, feeding with expressed milk is quite different. Direct breastfeeding is so much more easier. Studies have shown us that no matter how much you sterilize equipment, it could be your pump equipment, it could be the containers that you collect milk in, it could be the spoons, the cups, there's always going to be some amount of residual bacteria. So it is safer to just let the breast do its job, safer to let the baby do the sucking on the breast rather than pumping milk, expressing it, storing it, and then feeding it through another method. So the outright answer is no. However, if required, let's say the baby is in the NICU or the mother for any reason cannot sit up and feed or is unable to feed the child, in such cases, yes, we'd still want breast milk to be given, so pumping makes sense. However, even then we recommend hand expression and not a pump. And when you have to buy a pump, say the NICU stay for your baby is going to be about a month or 2 months, in premature babies or babies with surgical issues and things like that. In such cases, a lactationist is going to measure the size of the nipple to the phalange available in the pump. Basis that, you can buy a pump. And even then, what type of pump needs to be decided. So please don't waste money on pumps. They're worthless, to be honest. Only in cases where they are indicated, makes sense. Until then, do not buy a pump.
Thank you, Swathi. Our mind is very strong. So if we have a plan B that the pump is there, our focus on plan A reduces. So let's not think about the pump to begin with. So only knowledge is important, but be prepared for only direct breastfeeding. Dr. Mohan, my baby is in the NICU or PICU. What are my options to breastfeed the baby?
Actually, in NICU, we see variety of babies, term and preterm babies. In that preterms, actually less than 34 weeks, we have a concern infection of the gut called necrotizing enterocolitis. Almost so many studies been proven now that mother milk is easily digestible, and neonatal mortality rate as well as this necrotizing enterocolitis, nothing but gut infection, is far less compared to formula. If we are using mother milk, definitely it will be this NEC incidence, mortality incidence will be quite less with mother milk. And also this mother milk will be something like a gestational wise, it will be different. Somebody who deliver 32 weeker baby, which will be around 1.5 kg and in NICU, definitely that mother milk will be having more protein. That is what required for the preterm baby. Somebody already crossed 37 week, their protein content will be lesser. Here we need more protein, that will be there in preterm breast milk actually. So it is something like gestational wise also, mother milk is the best one to decrease infection, infant mortality, everything. Almost in NICU, definitely we always go with breast milk only. Actually, we go for express breast milk depending upon the maturity of the baby, gut maturity, infection, all that. We start with trial feed, 2 ml, 5 ml, 6 ml, second hourly, third hourly, depending upon how baby tolerates. Some conditions like mother is not available, maybe very sick enough to be in ICU with some condition. That time, now the second option is for less than 34 weeks baby is even donor milk, because we have come up with many like blood bank, milk banks have come now because it is something new, but luckily we are in Bangalore. We have already 2-3 milk banks here who take mother milk and store in the refrigerator, then they provide to the babies. So at most we always try to minimize the infection rate with first breast milk or second is donor milk. This is the concept presently we are using in NICU for sick babies.
Always encourage direct feeds, as Dr. Mohan has already put. Sometimes preterm babies are unable to suck down the nipple directly, and in such cases encourage express milk, which can be administered to the baby as required and through whatever mode our eminent colleagues decide. Maintain nutrition and hydration for the mother to enable her lactation. Even if the baby is unable to take the feed, encourage for expression of breast milk and sometimes pumping to maintain the lactation. That is very important. Initial stimulation of the mother's nipple and breast as soon as after the delivery is very essential to initiate and maintain lactation. Either it is by the baby, if not expression. So we proceed to the next question. What is the best method to offer express breast milk? Dr. Anil?
So the best method is always we say direct feeding is the best. When for whatever reason, if that is not happening, then we look at the next best method to give. Definitely we say no to bottles to start with. So the more physiological way of doing is by giving an open cup method. So infants or even preterm babies as early as 34 to 36 weeks are able to feed so very well with a cup. With an open cup, we take the cup to the chin of the baby. We just make that mother's milk, which is expressed, to just touch the lips. Babies do such a pouting movement and they're able to take in the milk and they're able to feed through an open cup. So we always say the best method is to feed will be when direct feeding is not happening, we're giving an express milk, it's always through an open cup method is always preferable. Traditionally in India, we use a steel thing, that's a palade or illi olle anta karitivi, olle. So that is the next best thing, but we should make sure all these things are very well sterilized before use, and we need to take care of few things. Number one, clean place to sterilize, clean utensils, and well sterilized with clean hands. Only then express breast milk has to be offered through this. And we always discourage anything which has a like bottles or nipples, better to be discouraged at all times, just to make sure that there is no nipple confusion that develops for the baby later on. So this would be the best method to offer express breast milk.
Open cup feed, palada feed, spoon feeds, oral or nasal tubes in special conditions. I feel very hungry while breastfeeding and sometimes I feel cramps as well. Is this normal? Over to you, Dr. Divya.
It's very common for a post-delivery, that is breastfeeding mother, to feel hungry. As soon as she sits and starts feeding also, she feels very thirsty and hungry. It's very common. And many people think, why am I feeling like this? So why? Because now your baby has come out of the womb and it is definitely bigger than what it was inside your womb. And when the body is breastfeeding, to produce the milk, that extra nutrition, so the body needs that extra calories. So that is why it's very common to feel that hunger and thirst when you're breastfeeding. So nothing to worry about it. And extra around 500 to 700 calories, they say, more than what the body requires, you need when you're breastfeeding. And about the cramps, so many women also feel, I have just delivered, now again I'm feeling that labor pain kind of cramps when I'm feeding. That is also very common, and it is more common after the second delivery. That is what we see. So this is because, like, when we start feeding the baby, a hormone called as oxytocin gets released from the brain. So that hormone helps in the milk secretion also. Also it helps in uterine contractions. So that the uterus goes back to its normal pre-pregnancy levels. So initial few days it is very common to feel the cramps when you are breastfeeding.
So yes, this is normal, and let's focus on the nutrition to tackle this problem. You burn 400 to 700 calories per day making milk. So it is very, very essential that you maintain your nutrition. Eat healthy so that you don't put on unnecessary weight. Avoid simple carbs, so include lots of fruits, vegetables, nuts and salads and sprouts in your diet. So this will give a wholesome nutrition and help you to tackle with hunger. Practical aspect, while you're feeding, keep a glass of milk or a snack ready so that baby is feeding, you also have, so you don't feel tired, okay? And drink water as well. Okay. This will help a lot in tackling this problem. My baby is 4 months old. Family tells me my milk is not sufficient, and that's why my baby cries every so often. What can I do? Dr. Anil?
The moment baby starts crying, mother comes to a conclusion that the milk is not sufficient. That's why the baby is crying. So then they start experimenting with various other things other than breast milk. They start giving other milks and all, get into problem. Number one, we need to make sure that not enough milk. This kind of a thinking by the mother, is it actual thing or it's a perceived notion? Many a times, I would say more than 90% of the times, it's just a perceived notion. Especially this madam is asking for a 4-month-old. So mothers are used to seeing babies grow by almost 600 to 900 grams each month in the first 3 months. So then what happens, our natural growth trajectory is kind of flat. So 4th month, the baby may not grow as much. And even the feeding frequency will start settling down. Babies will take little longer breaks between feeds. So the demand for feeds is a lot lesser by 4 months. So it's natural for anyone to feel that the milk is not sufficient, baby is not growing, and baby is crying so often. Again, each cry we should not associate it with hunger. Babies cry for many reasons. Babies cry if they're cold, if the diaper is wet, something irritating they cry, they're bored, sometimes they do cry. So we need to make sure that the family or the mother understands the hunger cues as to when the baby is hungry and to comfort the baby and feed on demand. First and foremost, we talk to the mother, get a proper history. We chart the weight. We look at what has been the weight gain that is happening in the last 1 month. That's why every time you visit a pediatrician, you'll be seeing that we chart the weight of the baby. So that is the reason. So we go back and see what is the weight gain that has happened in the last 1 month. We reassure the mother. There are other signs which tell us if it's actually the feeding has been less. If the baby has gained less than 500 grams in a month, or if the baby is passing less than 5 times urine, that too very concentrated urine, these are telltale signs that the milk transfer is not happening. We don't say that milk production is not happening. We say that the milk transfer isn't happening. Okay. Then there may be other things, that the baby is becoming too fussy, not settled after a feed. So all these history we take, we assess a feed to see as to what exactly is happening. Is the lactation technique correct? Is there other factors that are coming in hindering the breast milk transfer from the mother to the baby? We look at all this. Many a times it's all a perceived notion. So spending some time with the mother, trying to understand what is the concern and addressing that solves the issue, rather than just simply saying no, your milk is not sufficient, and we suggest other options. That should not be done.
Yes, look at how your baby is growing, how your baby responds, how your baby feels, and the growth charts and everything. Assessment of breastfeed. We've noted that some mothers, they kind of manually or express the milk to check whether how much quantity of milk is actually being secreted. Mind you, this can never be accurate because there is the flow of milk to the baby is by sucking, that is by suction, as well as the natural flow or the let down by the hormones. And this happens as a cycle. Initially, the flow may be little. In the between, the baby gets such good flow that whatever is required is kind of brought to the baby in that initial 5 to 10 minutes itself, and later on the baby just plays. And when the baby's stomach is full, you keep trying to make the baby feed, baby gets irritated and starts crying. So understanding these cues is important. Other practical tips which you should understand, when the mother is feeding through one breast, she is having adequate lactation, she has an automatic discharge of milk through the other breast. And if it's more than 2 hours, I find the breast heavy. While taking a shower, you note that you're just leaking milk. All these things indicate that you are having adequate milk supply, and you should be very confident and not get scared. And our Indian family system, we have lots of people at home who keep telling you that baby is crying, no, baby is hungry. Look at the tummy, it's flat, baby is hungry. No, just go through, be confident, be calm, address it very peacefully and with lot of confidence. You will never face a problem. Weight as per age, as Dr. Anil has indicated. Assess mother's nutrition. So again, in our system, we have a problem with lot of food fats. People say you should not eat this, you should eat that, and improve milk digestion. Baby has burps, baby has flatus. All this is related to the whatever food you ate and all. No, baby's breast milk is not a filtrate of your food. Breast milk is active secretion by the breast to the baby according to the needs of the baby. As Dr. Mohan has already told, preterm babies have a different composition. Term babies have a different composition. Let's not generalize, let's not worry, no need to give top up. Every mother can feed her baby. Every baby can strive only on breast milk with nothing else for the first 6 months. So let's go with that attitude, then everything will fall in place. Other causes of crying, yes, that has to be looked in. How do I manage supply of breast milk once I start working? This is a challenge, and over to Dr. Swathi.
Honestly, this is where you need to start talking to people, talking to your support system to understand how do I maintain supply and what do I do. While we say 6 months of exclusive breastfeeding, somehow our Maternity Act didn't consider the difficult phase actually starts after that. You're going to work, your child is now starting complementary feeding, supplementary feeding. You want something to be given to the child when you're not at home, and you don't want to stop breastfeeding also. And this is perhaps the most difficult phase. So it makes sense for you to sit with your lactation consultant or sit with your gynecologist if necessary to understand what should your plan be. And this should start at least 3 months before you go back to work. The reason we say 3 months is depending on the kind of work you do, depending on the kind of environment you have, you may need to start pumping 3 months in prior to save milk, store it up, keep ready when you go to work. Now, let's say you're working in a government setup, the Maternity Act is really strictly followed there. The private, of course, has its own constraints and restrictions. If you're less than 50 women, you may not be given a room to pump. But in a government setup, whether it's less than 50, whether it's 5, whether it's 1, you still need to have a feeding room and a pumping room. So those are some of the benefits there. But if you're in such a place, then you also have the freedom of coming back home to feed your child and going. So you have to plan your day. Before you go for work, you need to make sure you've fed your baby once. So at wake up time, you feed your baby. You feed once just before you leave. And between the first feed and the second feed that you give your baby, you also try and express some milk, keep it at home ready for the caregiver to feed. And if you can come back home by say lunchtime, feed once more and go back, fantastic. And evening when you come home, you feed and you follow your night feeding as usual. But let's say you can't come home, then what do? And I did this, right? We used to pump at work. So I used to carry my pump with me, I used to pump at work. And remember, when you're doing all of this, sterilization is not to be ignored. You need to make sure everything is clean, absolutely good, and maintained hygienically. So you wash your hands, you pump at work. So you have a clean room, you have a clean surface. If needed, wipe down the surface that you're going to put your stuff on and then start pumping. Once you have pumped, the milk needs to be collected in approved containers. I have seen mothers who have come with collected milk in Bisleri bottles, right? Absolutely not acceptable. You've just contaminated the golden liquid we want to give the baby. So make sure that the containers you collect are appropriate and user-friendly. Second thing, it needs to be stored. We work in environments which do not have temperature regulation. India is varied from being 1 degree centigrade to almost 46 degrees. Breast milk at room temperature or less than 28 degrees Celsius can stay well for between 4 to 6 hours. But every degree raise in temperature means your hours come down. So at 30 degrees centigrade, you can perhaps keep your breast milk just for about 3 to 5 hours and not more. So at work, when you're going to stay for 8 hours, ideally you want to put it in a refrigerator. You have freezer-safe pouches available, you have freezer-safe bottles available. You also get traveling coolers. So you collect your milk, put it in the fridge. When you're leaving back from work, you put it in this cooler bag or cooler freezer bag as we call it, and bring it back home, transfer it to a fridge immediately. So there's a lot of planning that is required, a lot of logistics that's required, which is why I'd always encourage, talk to people, do your research, understand what your requirement is. If it is going to be just one feed in a day that you want to pump and feed, then you might as well hand express, collect that milk and give it to the caregiver. But this is just the feeding part of it and the supply maintenance. Most important to do the maintenance of it is to do a night feed. Prolactin is a hormone that makes milk and is secreted in the early morning hours between 2 and 5. Around 3 to 4 is what we say, which is why you will see your baby waking up so many times. They can smell prolactin in your, in your body. So it's essential that you continue this night feeding and you continue night pumping because you want to make sure prolactin is released, more milk is made. You empty your breast, make more milk. So the demand and supply is established and continued even if you're not next to your baby the whole day.
That was very elaborate, Dr. Swathi. So the same prolactin helps in contraception as well. That's why night feeds are very important. Feed and pump before leaving home, pump at work. Please make your path and get this going. Feed as soon as you get home. Continue night feeding, pump early morning. Just to add, it is important that whatever is the stored milk is brought to kind of room temperature and transferred to sterile containers to feed the baby. Again, try to avoid bottle feeding. Try to give the express feed in the form of in a pallida or in a cup, direct cup, as Dr. Anil has already told, because feeding through the bottle can increase nipple confusion and the baby may start not feeding on the breast as vigorously as earlier, because through the bottle the milk flows in easily to the baby, and we are all lazy, isn't it, including the babies, so they will start looking for the easy bottle feed rather than through the cup and spoon. So don't ever make your baby get used to the easy ways. I exclusively breastfeed my baby, but my baby is not as chubby as my neighbor's baby. What should I do?
I always tell being chubby is not equivalent to being healthy. So chubby or not chubby, it's in our genes. So many a times it happens that some people have a very good BMR. Their basal metabolic rate is so high, so how much ever they feed, they don't appear chubby. Whereas some babies are chubby from the beginning and they continue to be chubby. So I guess it's very individual. Exclusive breastfeeding is what is required. Like I told, we keep checking their progress in the on the weight charts. We will see what is the weight gain in each successive month. So that is more important. Having a progressively gaining weight and sticking to the centiles of the charts, that is much more important than looking chubby. So I guess it's all individual and related to the genetics.
Go more by the activity and the healthy look of the baby, lack of diseases. Assess and reassure, weight gain as per age, baby active and healthy, meeting milestones. These are all very important. Genetics, as Sir has already told. Another thing is chubby baby, as Sir has already told, may not be healthy baby. especially what we should understand is childhood obesity, where the fat cells have number and size. Okay, so childhood obesity is due to the increased number of fat cells, what we call as hyperplasia. So with this hyperplasia, the number of cells will never reduce later on. So even if baby tries, or the baby when they grow up, they try to lose weight, it is very difficult to tackle childhood obesity. A person who was thin to begin with and later on has put on weight can exercise and can do diet and reduce weight and thing. So if you are avoiding childhood obesity by reducing overfeeding, reducing and avoiding formula, you are doing a great help to your baby. Not only in obesity, in reducing diabetes and other metabolic syndromes later on. It hurts to breastfeed. Everyone tells me it's normal. What should I do, Dr. Divya?
It's very common when the initial period of post-delivery, when you start feeding, it's very common to feel that pain in the initial time. So once the latching on happens, means proper hold is there for the baby, after that pain shouldn't be there. But if the pain is continuing even after proper latch, then we will have to look into other things which can lead to pain, like soreness of the nipple, cracked nipple, all this we have to, when you get that pain even after proper latching, then you have to show to your gynecologist to check for all this. And how to prevent soreness or cracked nipple is proper latching of the baby. That means that the whole nipple plus that black areola around the nipple should go inside the mouth, and the baby's mouth should be full of that. So there shouldn't be a gap. So that is proper latching. So if proper latching happens, cracked nipples and sore nipples can be avoided. And next is other problems like, as I already told, this inverted nipple. When the nipple doesn't come out during feeding, also can lead to pain during latching. So that needs syringing and then pulling out the nipple and try to feed this thing. Even with inverted nipples, people can directly feed the baby, but it requires little training, and with help and all these things, it can still be done. If mother is not able to do even with that, then we'll have other helps like the pump milk, or with the breast nipple shield also is available. Through the nipple shield also the baby can be fed directly. And one more thing is which can cause pain is another thing is mastitis, where there may be some infection, or the ducts can get blocked sometimes. So some white tubercle seen on my nipple, what is this? Many patients get worried. So that can happen because of some duct blockage. So you just have to wipe the nipple properly and then try to put some hot water back, and then try to feed the child or express the milk. So that will help. If that is not helping, then you have to consult the doctor for further treatment.
That was very helpful. Just look for all the cues. This baby here is showing that the lips is curved, the most of the areola is into the baby's mouth. Mind you, if you focus, actually the nipple almost goes into the throat of the baby, not into the mouth. So when the milk gets ejected, it directly goes to the food pipe. So that will enable lots of milk to be delivered to the baby. So if this happens properly, there is no pain. So actually, if you check, your nipples are tender, not the areola. So the pressure should be on the areola, not on the nipple. And if there is a fault latch, sometimes when baby is crying a lot, you just try to feed baby, just clutches on and clings on and bites your nipple, and you get a sharp pain, and then that will discourage you and you will have negative hormones. So try to tackle that slowly, calm the baby down, encourage good latching. And unfortunately, if you had developed sores at a point, you change the position of how the baby is held. So sometimes what we call as football position. So this will help to give rest to the part which is already having a small wound, and the pressure is transmitted to other healthy area. So this way lactation is continuing, and because of rest that area heals. Another practical tip is hind milk. Hind milk is the one which has a lot of fat and a lot of lubrication. So once you feed, you just express a little more milk and smear it over. That itself is the best natural lubricant. And mind you, we should not keep applying soap and washing the breast and nipple every time thinking that I have to keep it clean. No, it's all clean. Just while taking a shower, give a good soap wash and keep it. Rest of the time, dryness is the one which causes more chafing, and if you keep washing with soap and water, you will cause more dryness or more chafing and more pain. So these things will help you a lot in avoiding these. So it's supposed to be joyful, enjoy it, get a latch check, feeding position, assess baby for oral issues, nipple infections. Here you may need to take help from your pediatric colleague. They can look for oral thrush in the baby, and in these situations, mother as well as baby have to be treated with antifungals, and which are the ones safe in lactation. What are the common problems faced by working mothers?
All of us are working mothers right now, aren't we? So yeah, I think one of the biggest problems that we face in the Indian scenario, or especially the South Indian scenario, is lack of family support. 6 months later, we still have to work for multiple reasons. Could be because we want our career to continue, or for financial reasons, but those cannot become hindrances to breastfeeding. So which means that if the mother needs to go to work, then someone else has to pick up the slack that she's not at home. And that someone could be a caregiver, could be a family member, could be a neighbor, could be anyone. There are rules that say that you can take your baby to the work at a creche close by or a play home close by and things like that. But you need to figure out what is going to work for you. At some point in time, your family has to be invested. The second biggest problem that we see in Indian scenarios especially is that you become a mother, but you don't stop being a wife, you don't stop being a daughter-in-law, you don't stop being a daughter or sister and so on. So which means you're still expected to cook, clean, take care of the house and still do everything else that is new on you. So I think you should start setting realistic expectations to yourself. If it means you need help to get your house cleaned, so be it. If financially that is not acceptable or that cannot be done, then you need to figure out time where you're doing a little bit of your morning activities in the evening so you have some more leeway in the morning. But working cannot be stopped is end of the day the story. So you need to figure out what works for you within the limitations that your life has. There's no sense in crying about it and saying, this is what it is, what do I do? That is life. So you need to see what can be done. Be open to asking for help. There is no shame in asking for help. Even if it means going up to your family and saying, listen, I need to do this at so and so time. You need to be here for the child. Be authoritative, get your work done. If it means you need to take support systems from your family and friends, so be it. Beyond all of that, I think you need to talk to people. We are working women, at least the last 2 generations, we've been working, my mother, me, my kids, we've all been working. Sitting at home for 6 months doesn't really work for us. We've been active women. We want to be active doing things. So then the minute we start to work, we start to invest ourselves fully. We sort of want to do that because, we have this sense of feeling saying, if I don't do, my promotion is going to be, affected. My salary hike may be affected. People may think less of me. So set realistic expectations of yourself and tell yourself it's okay to achieve one goal at a time. And that one goal could be, I want to finish this day on a high. I want to finish this one task. I want to go back home with a peaceful mind to get back to my child. So find your support system. Make sure you create your pumping schedule or feeding schedule. Make sure your support system is understanding of your method of wanting to raise a child. It could be something as simple as wanting to feed your baby sweets or not feed your baby sweets, right? So those need to be addressed well in advance, and you need to perhaps keep reiterating them because the caregiver may not know or may not understand what you are saying because they come from a background of what they did when they were mothers themselves. Reiterate, explain, provide scientific evidences. I have mothers who have come to me and said, can you explain to my mother why it is not good for my child to get water? Because I told and my mom told me, what do you know about life? So be it. It's okay. If it needs that, you need an expert to talk to your family, be it. The experts are ready to help you. So find your support system, set realistic goals, and for the love of God, do not get mom guilt. You are doing your absolute best. No mother wants to do bad for their child. So please understand, this is life. Life is difficult, but you will be able to sustain and survive if you figure out what works for you and find those goals and achieve them.
Just to add, focus on your own health as well. You're faced with a lot of stress about the breastfeeding, about the baby in your absence, and your work and your schedule. I'm sure everybody's sleep is very much affected. Food, eating, everything is affected. Just ensure good nutrition, good hydration, and try to sleep. Here as well, take help. Feed the baby nicely, give to somebody, go to a separate room, put whatever conditions are, conducible for your good sleep, and try to have a very good, deep, refreshing nap, at least a few hours, at least 2-3 times a day, and that will help you to go a long way in fighting this stress. So, family support, awareness of law as well. Drop in milk supply, yes, there can be sometimes your perceived or real sometimes drop in milk supply. If you feel that there is a real drop, please meet your physician, your pediatrician or a gynecologist who will help you to cope up with this, sometimes through medications as well. Stress, proper planning will help you a lot. So, to summarize, breastfeeding is a teamwork and both parents need information and support for their different roles. Access to adequate paternity and parental leave can allow the non-breastfeeding parent also to have time to share the household responsibilities and provide other support to enable mother to breastfeed. A supportive workplace includes providing maternity or paternity entitlements to parents will enable continued breastfeeding and thus improve child health. This results in less absenteeism and enhanced productivity at work, which is beneficial for the employers as well. Parents need support from the whole society to enable breastfeeding. A warm chain of support for breastfeeding needs to be established, including the health sector, workplace and community. Try for breastfeeding friendly hospital initiative to have trained healthcare staff, obs-gyns, pediatricians, nurses, lactation consultants, and it's a teamwork. Inform all pregnant women about benefits and management of breastfeeding. Help mothers initiate breastfeeding within 1 hour of birth. Show mothers how to breastfeed and how to maintain lactation. Practice rooming in, encourage breastfeeding on demand, link mothers to trained lactation staff for outreach. So now it's time for audience questions.
Thanks, that was so helpful, but I have, oh my god, so many questions. As a mother of two, I've had all the questions that you put on the PPT and so many more. To begin with, I want to ask about the mother itself. So, I've been a mother who's been active till the last day. I drove myself to my delivery and I was active from day 2, maybe not day 1. So a lot of people keep telling me, if you don't rest now, you're going to have problems in future. In fact, I met a mother who was active like me, and I met her after 1 year. And she was telling me, I wish I had rested right after the delivery. Now I have so many back pains, headaches, and so many problems, breast pain, stomach ache. Is it true that if you don't rest the first 3 months, like if you're lying on the bed, then you'll be okay for the rest of your life? If you're not, then you'll have so many problems, back pains. That's my main question, because I cannot be a mom who's resting all day and like sleeping when the baby's sleeping. So I just want to know if that's true.
It's not true that you have to completely bed rest after the delivery. Okay, so you can do your regular activities, everything, taking care of the baby, everything, but you will have lack of sleep because throughout the night you will be waking up so many times. So we always say, when you're taking care of the baby in the initial few months, you have to rest when the baby is resting. So that is to catch up with the sleep, and your body also would have got tired after the delivery. There will be a lot of blood loss and all that. So your body needs some time to recover from those blood loss and everything, for which you need good amount of rest. Means I will not say bed rest, but you will have to take adequate nutrition in the postnatal period, because you will be breastfeeding also, and as you have lost blood and everything during parturition, that thing also you have to regain that strength. So for that, good amount of nutrition is very important. Many Indian families, as she told, there are lot of food taboos. So they say that you shouldn't eat that, your baby will have this, that. So it's mainly because of the food practices what they follow in the home, that makes them weak, and back pain and all those problems happen because of those things, not because you have not rested completely.
To just add on, just ensure that you get your whatever 7 to 8 hours of sleep. It is impossible to do it continuously because you have to feed the baby at least once in 2-3 hours. So in breaks. So as I already told you previously, just ensure you get good sleep, Sometimes you may need to go to a different room or something, do something which helps you to rest well, rest as in sleep, and focus on your postures. Most of the time, back pain is because they don't sit properly and feed. Your baby is crying, sit like this, like that, bend, sleeping, bending without back support, without any support. No. Have a proper feeding chair. Ensure your proper straight posture with a lumbar back support. Keep a small stool or step below your feet so that you don't keep your legs up, and then keep a pillow, keep the baby on the pillow so that you don't bend. So if you maintain your postures, breastfeeding, you'll end up feeding for almost 8 hours a day sometimes, or more also. So that 8 hours, if you focus on your proper postures, you will not get back pain anytime. And there is also a lot of myth. You had epidural, you had cesarean, this is causing back pain, you shouldn't go for this. No, everything depends on your postures and your nutrition, and sometimes your supplementation also is required. You have anemia, you require supplements, and all women in our Indian food cannot supply appropriate amount of calcium. So you need calcium and iron supplementation, and yes, and a little exercise. Good brisk walking, sometimes in between, sometimes continuously, will help you to maintain your muscle strength. If your muscle strength is good, your back is good, so you will not have back pain. So it is a wrong feeling that you should be under stress. If you are always under rest, all your muscles go to atrophy. When you restart at 3 months, when your button is pressed that now you can be active, then you will face a lot of problems. So this is how you have to deal with this. Any other questions?
Their baby has a tongue tie. Is it difficult for them to feed?
Most of the babies will have mild one. If our lactation specialist Swathi involved and established direct breastfeeding, absolutely nothing is required. If really it is severe enough, then pediatric surgeon will assess and take a call about releasing it. And it is something like a minor procedure only, not something very serious one. If Swathi gets satisfied with the feeding, direct breastfeeding is happening, nothing is required in newborn period. Many will be having mild one.
Adding on to that, so most babies who have a tongue tie usually are able to get enough milk into their mouth and bellies and show a good weight gain pattern. The concern is when we do not see a good weight gain, or we see the baby being extremely fussy. That's the first thing. If yes, then we'll get it assessed. But if that is not a concern, the second time that you're going to get assessed with a tongue tie is when the speech starts. Sometimes a tongue tie may affect speech. In such cases, you want to go back to a pediatric dentist and surgeon to have it assessed. Otherwise, tongue ties, as long as it's not causing trouble to the child and the mother, please continue. That really shouldn't be a cause of concern.
Hello, doctor. Can you please let me know what exactly is tongue tie?
Tongue tie is where the tongue is kind of attached to the floor of the mouth. If you feel within your mouth, you see a small frenulum, or the connection which connects the floor of the mouth to the tongue. All of us have it. Some of us will have it strong and a fibrous one, where that movement of the tongue is restricted.
I'm having one question. When I express my milk, I hardly get 5 to 10 ml. I wonder if that is enough.
Again, the answer is no, it's not. The baby's sucking physiology is extremely different from the expression, hand expression, or a pump expression physiology. So when you look at how the baby sucks milk, it is able to draw in milk from the deepest ducts available in your breast. Whereas the suction is waiting for the front of your ducts to empty, and thereby the back milk can come to the front and thereby pumped out again. So every time a mother comes to me and says, I expressed for 15 minutes, I only saw 5 ml, I'm not sure if my child is full. The answer is, why are you expressing and checking? Trust your body. You've delivered a baby, you've taken care of this baby, trust your body, put the baby to your breast. If the baby doesn't want milk, he will not drink it. I say he, it could be a she as well. But if the baby is still crying and hungry, then yes, we'll have a check, because sometimes maybe there's a reason why you do not have sufficient milk. That could be something as simple as not being hydrated enough, not drinking enough fluids, and like ma'am was saying about nutrition. Nutrition is so important. If you are not eating well, you are not healthy, there's just no way you can have a healthy baby as well. So those are few things that we'd like you to address. But if there is a cause of concern, then your doctor should be able to help you. Sometimes, like ma'am said here, that there could be medicines that are given to help you increasing your milk supply. But the fundamental answer is demand equals supply. So start feeding your baby more often. The more you feed, the more breasts get emptied, the faster they fill up, and the better your fill up is. But expressing and checking is not a good measure at all, and it's incorrect to be doing it. You're not doing justice to yourself.
So this happened to a friend of mine. She delivered 2 babies, one in the hospital. But they followed practices that I personally, as a layman, felt were wrong. As in, she had a C-section and the baby was directly taken to the NICU and fed formula. And she didn't feed the baby within the hour, the first hour that you call the golden hour. And later the doctor suggested that she first expresses, feeds the baby with palada or a bottle, and then latches the baby for breastfeeding in the single feed. So obviously, as a layman, even I know that is wrong. First you need to breastfeed and then express the baby is not drinking. And because of all this, she lost the milk supply within a month. Initially, where she was expressing 30 ml, 40 ml, she lost it within a month with both the babies. Why are these practices still followed, like even to this day in big hospitals? Is my question. And was that the reason for her to lose the milk supply?
What most hospitals follow is what was displayed at the end, what we call as a baby-friendly hospital initiative. That starts with having a written policy which is well communicated with everyone regarding the golden hour management. So we all follow that. In fact, in our labor room, we follow as soon as ma'am delivers, we make sure that there are no life-threatening conditions for the neonate. First thing that we do is to skin-to-skin contact, and we even go ahead and initiate feeding as early as in the labor ward itself. Even in the C-section, sometimes we have, even before the abdomen is closed, we have made sure that the latching happens and the feeding is initiated. So, and we try to remove all barriers for establishing a successful feeding. So we always encourage rooming in early, as soon as possible, that the mother and the baby are in the same room. So the initial support is of course provided. We have Dr. Swathi here with us, who kind of supports women with any kind of lactation issues. She's around even before the delivery. Like we started antenatally also, we start sensitizing the mothers to the importance of breastfeeding. During delivery, we make sure that the golden hour latching happens, the feeding is initiated. And from there on, staying with the mother for a couple of days, and even after discharge, we kind of do follow up. So that is more important, that we support the mothers in each and every step, even before delivery, during delivery, and even after delivery, and well into the infancy also. So by doing all this, the successful breastfeeding rates are much higher.
When you are working in this type of referral center, almost 90% of the delivery will be something like uneventful. Remaining 10%, either baby or the mother, some issue will be there. Suddenly mother BP shoot up 200 by 120, and we are behind going for breastfeeding when mother may get some other problem. So first is healthy mother. Somebody already lost much blood, her hemoglobin had dropped. Now we are thinking about giving her blood transfusion, shifting her to ICU. These are all the cases, special cases, where we have to first see mother condition, and she is stable enough, then only breastfeeding issue will come. Because baby can have some alternative where mother cannot get any alternative. First, stabilizing mother is important. Somebody is shifting mother to ICU, then going behind her with baby there. Already so many other cases where in MICU some infected cases will be there, pneumonia, all that will be there. We don't want our newborn baby to expose with other pathogens. Okay, so you have to individualize. Society, that is fine. Breastfeeding is the best, but we should not compromise with mother condition. Mother should be healthy enough. Then only we have to go with breastfeeding.
To answer the second part of your question, so initially the milk flow was good and later on it reduced. It's just because demand and supply. So had the baby had been suckling, whatever reason why, as Dr. Mohan, probably it was very necessary for that situation. But otherwise, if the baby sucks, then the milk flow is maintained. Since the baby didn't suck, milk flow reduced. But it's not the end of the story. If the baby sucks again, it will come back. So that is what you should understand.
My question is like, when a baby is crying a lot, can we give the baby like dry water?
My 15 years experience, I never advise for anyone. Actually, colicky pain, what we usually tell, because of some complex mechanism where baby cry, but there will be good weight gain, baby will be taking feeds well, with no other reason, no any warning signs. We usually see persistent vomiting, baby otherwise fed well, was playful in the morning hour, evening some fussiness is expected. Some babies we don't know, sometimes overfeeding may be the reason, constipation may be the reason. So you have to address what problem may be. Even gastroesophageal reflux where milk usually comes up, and usually regurgitation do happen with many babies. Sometimes if it is severe enough, may cause some burning sensation in the baby. So immediately after feeding, baby may cry. So there we have to individualize and try other medicines. Nothing like gripe water is for all crying baby, we just give it. It is contraindicated and we never advise it.
So, thank you, Dr. Mohan. So, due to lack of time, I think we shall address all the other questions later on. Okay, one last question from Samyukta. Come on.
I am father of a 1-month-old daughter. So she was born on 9th July 2023. She does very good, my wife does, her mother does very good breastfeeding, and she is happy to have it. But I have one peculiar question. I'm sure that others might face it. My question with my daughter is, until she's breastfed, she is fine. After breastfeed also, she is happy. The moment I kept her on bed for sleep, she starts crying, and then again I have to carry her. Then she sleeps on my shoulder. Okay, but I believe it is due to the interaction, like body to body interaction. She feels close or something like that, but it's fine. But it happens till night also. Like during night, we have to take her up so that she sleeps. Then if we keep on the bed, again she sleeps. So we have understood 3 things where she cries. One, she pees, she cries. One, she potties, she cries. For hungry, she cries. I can understand her hand expression when she is very hungry. So these are some basic expressions that parents will try to identify. We don't know that. So apart from that, she won't cry, but the moment she is on the bed, she cries.
It's quite commendable. The way you said that mom is happy breastfeeding, baby is happy feeding it, and overall as a family you are happy with it. That is quite commendable. That's one thing. And you are also starting to understand the cues of the baby. Babies cry for various reasons. You have understood that. They cry for hunger. They cry for any kind of discomfort, slightest cold, change in temperature, change in whatever. People say that even slight change, they're so used to mother's sweat odor. So even little perfume or something changes, they're upset and they do cry. So there are thousands of reasons as to why babies cry. So welcome to the journey of parenthood. See, as long as breastfeeding is happening, babies are gaining weight, I think this kind of fussiness is okay. And whatever you do now becomes a habit. The way you comfort your child, the way you keep on doing it, probably baby is enjoying it and it becomes a habit. And crying is natural for a newborn. Okay. Don't think that crying means discomfort. Don't equate that, because that's the only thing baby can do at this point in time. So as long as the breastfeeding is happening, you told that baby is happy with the breastfeeding, mother is happy with the breastfeeding, and baby is gaining weight. So that's fine.
This type of some physiological issues where weight gain, everything is okay. Some things will be something like age related when usually as the time goes, they usually get better. Time is the cure. Something I use the word there. Time is the cure, where whatever problems is there in first 1 week or 2 weeks will not be there after 1 month. Some new will come. That we have to face.
Thank you, doctors. Thank you, everybody. And it's so heartwarming to see such beautiful attendance and response to this. All little babies and new mothers. And thank you, sir. I really appreciate your presence here, because it is very, very important to tackle these issues as as partners and then family. And you have set a absolutely fantastic example for this. And I think we have to applaud the couple for this. And with this, I would like to end the session. We'll be answering all the other questions and queries later on, and this video will go online, and then we can address all the queries. Thank you, everybody, for your commitment and your support for this being such a successful session. Thank you, one and all.